The consequences of uninsurance affect those who are uninsured and those who are insured who live in that community. All of us are in the boat together.
18,000 people die every year because they're uninsured.
A country should be judged by how it treats its less fortunate. In that respect, I'm ashamed of our country.
We can make everybody feel good, but if the internal costs are still driven up 3 times faster than wages, it simply cannot be sustained.
All of these plans have a substantial element of unreality to them.
Health of the Nation, coverage for all Americans, is a project of the New England Journal of Medicine. It's a production of the Fred Friendly Seminars at the Columbia University Graduate School of Journalism.
Panelists, let's start with the proposition that it is springtime, 2009. We're in the city of Metropolis, in the facilities of a suburban doctor, Harry Oldman. He's got to get to Washington for some professional thing, and he's got a few patients this morning. He wants to get through and get to the airport. He's seen Robert. Robert's about 50. He's in for a sinus condition. The real problem with Robert is that he's 80 pounds overweight, and he smokes like crazy. Steve, in the couple of minutes you've got, what do you say to him?
How long have you been smoking?
25, 26 years.
Do you know what it does to you?
Yeah, I know it's bad for me, but it makes me feel good. I like it.
Ever try to stop?
Yeah, 5, 6 times.
Okay. Would you like some help in trying to stop?
This morning?
Yeah.
I thought you were going off to Washington.
I'll stay around and help you. This is the most important thing that I could do for you. I could add 10, 12 years to your life, give you the opportunity to watch your grandchildren get married, have you and your wife have a good time after you stop working. Very, very important for you.
Reed, if you were Dr. Oldman, what's going through your mind?
I think what's first going through my mind is how tough this is going to be, because you've heard the message a whole bunch of times. So what am I going to be able to offer you that's different and unique? What kind of resources are available in the community? What kind of partners I can get together? And I'm also thinking about your family, because I know I've got to get to your wife, I've got to get to your kids. I'm going to have to put together a combination of punches to knock this problem out.
Reed, you're making this sound like a full-time job. I'm only one of your patients.
Well, that's why I say that as a doc thinking about this for the 5 minutes that I've got to be worried about you as a person. I also now am starting to think, what are the combinations of things that can come together to not only help you, but I got a bunch of other people I got to be a part of.
All right. The good doctor heads off to the airport. He's on his way to D.C. Actually, we're in D.C., and we're walking on the Mall. And you're talking about health care and reform. And you're saying to yourself, what is it we want for Americans in terms of their health status?
Well, for old Robert back there, I'd say, we're going to work on you. Come with me to Washington. I'm a heart and lung transplant surgeon. Have done that for 20 years every day. And in truth, I don't determine health for people listening. The determinants of health, how you define it. How long you live, they're determinants of genetics, pretty good impact, socioeconomic status, how rich, how wealthy somebody is, not that important it ends up being. In terms of environment, some impact, but not that great. The big one is, going back to Robert, behavior. How long you live is one measure of health. It probably has a almost 50% impact on how long you live. The one thing I hadn't mentioned is what I spent most of my life doing until I lost my mind and went into politics, in medicine. And the impact of hospitals, doctors, health insurance is tiny, only about 10%.
I have a bit of a contrarian view. I really reject the notion that health care doesn't make any difference in the population's
health. The senator said a small, compared to behavior, or what we might loosely call culture.
Well, it's not to deny that smoking, diet, and exercise matter. But if you look at mortality that's related to medical care, the U.S. is 19th out of 19 countries The Institute of Medicine said 18,000 people die every year because they're uninsured. They can't afford medications. People report that they go without needed care. So until we as a nation deal with the problem of 47 million uninsured, 16, 20 million people with inadequate insurance, we're going to be the only country where significant numbers are not getting the care that could be beneficial in helping them lead healthy, productive lives.
All right, as we walk down the mall, we see a group of people in white coats carrying signs. A fee for service is fairness. Capitation will decapitate health care in America. Who are those people?
Well, as the editor of Dismal Medical Economics magazine, I've heard from these folks for quite a long time, and they essentially see this through the lens, as most normal American capitalists would, of income. It's protecting their incomes. And
so
perhaps,
I take it you're telling me they're doctors.
Well,
or beauticians.
a certain group of doctors. But you see them as just one of the many competing interests.
Bob?
I'm trying still to get my mind off of that first patient, Robert, because as a general internist, I'm wondering about his sinuses. I'm just wondering. My experience was you better deal with the problem that they came in with and then get into the weight and the smoking. So I'm hoping the sinuses are okay. But look, Susan, I don't think you're wrong, and I think the way you framed it is one way to look at it. I also think you look at a group of dedicated physicians who kind of are watching the world change. And they don't get paid for talking about smoking, and they don't get paid for helping with obesity.
Instead of talking in the third person, let's get closer to that little group. And lo and behold, who's there? It's our friend, Harry Oldman. Art, you're Harry. Tell us why you're here.
Cherry blossoms. I'm here because I went to medical school. I'm loaded with debt that I still haven't quite paid off. I got an office full of people pushing paperwork every day. I don't have time to talk to anybody. I'm listening to this conversation I heard about in the abstract about smoking and weight. I don't have that 5 minutes to do that. I'm irritated that no one in Washington seems to care what I think about as a doc, so I came down here to try and bring some real-world perspective to the fact that you're crushing my practice. I can't function this way. I don't get reimbursed enough. I'm swamped by paperwork. I don't have time for anything. And I answered a bunch of non-MD folks who were telling me what to do half the time.
And on top of that, on July 1st of this year, I'm going to cut you 10%.
Anyway.
And right now, you're dependent about 50% of your practice on average, maybe more on Medicare. And I, government, I'm going to cut you 10% then. And then if the legislation passes that these congressional leaders here in Washington want to pass, I'm going to cut you 20% a year and a half from now.
And this reminds me,
that'll be the law.
This reminds me, I haven't had anybody to go talk to in Washington since Friss left.